You see the picture and everything. Okay, so our today's topic is fighting COVID-19, which is quite emerging as we have the problem of it and our quarantine is associated with it. So let's get it started and keep in mind that we shall be supportive, careful, kind, and alert as healthcare professionals. So during this meeting, try to find the answers to the following questions. So I want us to gain a little bit of basic knowledge. What are the characteristics of SARS-CoV-2? How the outbreak in Wuhan became a global problem? What is the diagnosis? What kind of treatment can we propose to the patient? What are the weaknesses? In what areas can we improve on? What does Ukraine lack in this aspect? Our opportunities, how the quarantine changes our life and how to get maximum of it, and the threats. So what may change in the world dramatically that may affect our lives in the future. So what is coronavirus? Coronaviruses are a large family of viruses. They gain their name according to the fact that they have crown-like spikes. They were identified in mid-1960s in humans. They cause a range of illnesses in humans from common cold to severe diseases. There are three different representatives in this family, which are SARS-CoV, MERS-CoV, and SARS-CoV-2, which is the novel one, the one that we are fighting right now. So SARS-CoV causes severe acute respiratory syndrome, the emergence of which was happening in 2003. The number of cases that time reached 8,098, while the number of deaths were 774. Fatality was not so high, it was only 10%. If we try to characterize the virus itself, you may see that the primary hosts were bats. The intermediate hosts were cavids and raccoon dogs. Incubation period was lasting 2 to 10 days, up to 14 days in some cases, and secondary case reproduction number marked as RO, which is the number of people infected by the first person that is ill, was 2 to 5. MERS-CoV, which was causing Middle East respiratory syndrome, the emergence of which was happening in 2012, had less number of cases. It was 2,506. The number of deaths reached 862, while the fatality was approximately 35%. The primary hosts were same, bats, intermediate host was camel, and incubation period was lasting 2 to 14 days. The secondary case reproduction number was pretty the same. And here we are with the new SARS-CoV-2, causing coronavirus disease 2019, COVID-19 happening right now. The number of cases based on the date right now is 1,013,748. The number of deaths is also not so dramatic, but still it's 44,189. Fatality reached 3.4% according to the data gained to March 3rd. And we don't really know a lot about this virus, so we may assume that the bats are primary hosts. The intermediate host is not identified. However, some people say that as it was associated with the animal market, it may be associated with pets like dogs or cats, but we don't have data on that. Incubation period is 2 to 10 days and may last up to 14 days, and the reproduction number is 2 to 3.5, so it's a bit lower. Let's take a look at how it was happening, the history of the outbreak. On the 21st of December previous year, a cluster of cases of pneumonia of unknown etiology, unknown cause, was detected in Wuhan, and China alerted the World Health Organization. Huanan Seafood Wholesale Market in Wuhan was closed for environmental sanitation and disinfection as it was associated with many early cases of the pneumonia of unknown etiology outbreak on the 1st January. On the 7th January, the Chinese authorities identified a novel type of coronavirus, subsequently named SARS-CoV-2, as a cause of the pneumonia outbreak. On the 12th of January 2020, China shared the genetic sequence of the novel coronavirus. On the 13th of January, Thailand reported the first confirmed case of the novel coronavirus outside China. This was confirmed as an imported case from Wuhan. On the 20th January of 2020, the USA reported its first confirmed case in someone who had returned to Washington state on 15th January 2020 after visiting family in Wuhan. On the 20th January 2020, COVID-19 was included in the statutory report of Class B infectious diseases and border health quarantine infectious diseases in China. During 22nd to 23rd of January 2020, the World Health Organization Director General convened an emergency committee under international health regulations on whether to declare the outbreak of novel coronavirus as a public health emergency of international concern. At that point of time, the evidence didn't constitute as it, but the committee members agreed on the urgency of the situation and suggested that the committee should be reconvened in a matter of days to examine the situation further. On the 24th of January, the first report of a case in Europe was reported by French ministry. This was not unexpected given to the growing number of cases reported outside of China by this time. On the 30th of January, the World Health Organization Director General declared the 2019 COVID, for the name of COVID-19 outbreak, a public health emergency of international concern under international health regulations. On the 11th of February, the virus and the disease it caused were officially named. The novel coronavirus was named Severe Acute Respiratory Syndrome Coronavirus 2, and the disease it caused, COVID-19. On the 27th of February, World Health Organization updated the case definition for COVID-19 for suspected, probable, or confirmed cases. On 28th of February, Nigeria reports the first case of COVID-19 in sub-Saharan Africa. On 11th of March, the World Health Organization Director General declared the COVID-19 being outbreak as a pandemic. So, if you take a look at the statistics, you may see the exponential growth of the cases, especially after 16th of March, even though the borders were shut. This may be happening due to the fact that before that the cases were not diagnosing properly and we were not having the diagnostic systems. And you also may see that COVID-19 death rate, if we try to see the age groups, the death rate is the highest in the age group of patients over 80. This is, in the first picture you may see the scale showing low risk, medium risk, or risk of you getting the COVID-19. In some institutions, for instance in Odessa Medical University, there are specific questionnaires for the students to fill in to try to see if they are in risk of being infected. Moreover, most of the institutions right now require a self-report from the students, whether they are infected or not, whether they present the symptoms like temperature, cough, etc. And you may see that people at risk are those who are older adults and people with serious chronic medical conditions like diabetes, lung disease, heart disease, cancer, and weakened immune systems. What can we offer to our patients as the diagnosis? According to the report from American Society for Microbiology, there are two available tests that we have right now, which are nucleic acid amplification test for viral RNA. It may be used to see if the current infection is happening, and antibody detection for past exposure to this virus. World Health Organization, in their recommendations, show that there are 6 core clinical syndromes, which are mild illness, pneumonia, severe pneumonia, acute respiratory distress syndrome, sepsis, and septic shock. In the same recommendations on clinical management of severe acute respiratory infection from World Health Organization, they are speaking a lot about how to isolate the patient, what are the prevention measurements and precautions, what kind of medications should be given. So mainly you may see that the treatment is symptomatic. We don't really have anything that would be etiotropic, and we are still waiting for a lot of different medications to come in, as we see that clinical trials have already been starting. World Health Organization provides the doctors with different posters that should be in all the clinics. So let's take a look at some of them. If you want to see others, please contact us and we'll send the 9 of them to you. So, for communicating with patient with suspected or confirmed COVID-19, the doctor shall be respectful, polite, and empathetic, aware that suspected and confirmed cases and any visitors accompanying them may stay stressed or afraid. The most important thing we may do is to listen carefully to questions and concerns, use local language and speak slowly, answer any questions and provide correct information about COVID-19. You may not have an answer for every question, a lot are still unknown, and it's okay to admit it. If available, share information and the handouts with your patients. It's okay to touch or comfort suspected and confirmed patients while wearing the personal protective equipment, gather accurate information from the patient, explain the healthcare facilities procedures to COVID-19. If the patient is a child, admit a family member or guardian to accompany them, and provide updates to visitors and family when possible. The next 2 show our problems we are facing in Ukraine as the healthcare specialists. All the personnel should be equipped with personal protective equipment according to healthcare activities. You may see that these include medical masks, gowns, gloves, goggles or face shields, etc., or sometimes even respirator. And these are obligatory for us. If we don't have it, we have a way higher risk of being infected, which may result into the upsetting statistics you may see in the world, that there are plenty of medical workers being infected and facing the struggles with this. In Ukraine, a lot of healthcare professionals are getting unemployed because they are higher than the risk group, so the healthcare professionals over 60 are leaving, and this remains to be a problem for us. Moreover, in some countries there is a specific guideline in case of the outbreak. All the students from the 3rd to the 6th year will be led to the frontier, so we'll be those who will be fighting and dealing with coronavirus in this case. It's really important for us to stay aware of the problem. Moreover, healthcare facility should be prepared with trained station at the healthcare facility entrance, with alcohol-based hand rub or soap and water, with well-defined and separate waiting areas, and these are compulsory also for us to give as much confidence to our patients as we can. So, what is happening right now and what may affect us in the upcoming future? The borders are closed and we don't know for the exact time they will be closed. So these may result into two next complications, which are deficits in some segments of market. You may see those crazy videos with trolley trolls that people are just taking out from the shop as if this is an apocalypse, and financial crisis and unemployment due to the fact that some of the economical areas are just shut down. For instance, tourism is having quite hard times right now, and this is something we may have to be prepared for. What is the psychological support that may be provided for anyone out there struggling and looking for something to cheer up themselves? So you shall turn to your institution for guidance, try to keep your regular routine, prepare for unexpected situations, support and be supported. Please try to find those who really need help right now, and in case if you need one, ask for it. Take care of your body. Make self-care a priority for this time. Control your level of anxiety and help to manage it in your community. And please don't stigmatize the patients with COVID-19, especially when those are not even the patients, but those who have returned from China and they are in quarantine zone, like it was happening in Novi Sanjare. So, during the age of social distancing, socialization still matters. Stay in contact with your peers with social medias. In some European countries, you may see these cute little notes from the neighbors that are doing some balcony timing. Moreover, you may see some discos out there. Musicians are having their concerts on the balcony, and a lot of journals are reporting on that, and you may see the posts in Instagram on that. The Wall Street Journal also reports a new trend called on Vine, which is the way that people are trying to support people in Italy and buying the wine from those regions that are devastated right now with quarantine and infection. So, let's have a little bit of interactive part. These are the statements. Try to guess if these are true or false, and write down in our comments, please. So I hope you've looked through all the statements, and let's now try to answer them together. Statement number A. Coronavirus may be transmitted by mosquito bites. Is it true or false? And this one was false. Although it's always appropriate to keep a safe distance from the insect that spreads paludism and dengue fever, respiratory viruses don't seem at this stage to be transmitted by mosquito bites, but by droplets of saliva or nasal secretions expelled by any infected person when coughing or sneezing. Statement B. Traditional Chinese soup containing over 20 herbs is proven to cure coronavirus infection. And this one is also false. The fact is that Xiong Qinzhen, who's a Wuhan-based drone engineer, spent over 2 weeks in makeshift hospital in February receiving treatment for coronavirus, and every morning and evening he was handed a bag of brown soup, which is this one, and it showed that he got cured. So there are several cases, and there is a research trying to see if it is effective or not, but still it is not proven as an effective treatment. Statement C. Rapid diagnostic tests for SARS-CoV-2 causing COVID-19 are in use worldwide. And this one is also not quite right. This is a rapidly changing area. There are now some tests, some are FDA approved, mostly for emergency use only. Many others are in development, and many are just on the market without regulatory approval. Many are out of stock due to global demand. We do not yet have good data available on which ones works well. Statement D. Coronaviruses are transmitted from animals to humans. And this one was true. Although not common, coronaviruses can be transmitted from animals to humans. Bats can be reservoir hosts for viruses which can cross species barrier to infect humans and other domestic and wild mammals. Statement E. Chloroquine, authorized for malaria, has potential to treat COVID-19. And this one is false. The efficacy in treating COVID-19 is yet to be shown in studies for this kind of drug. Statement F. Rinsing the nose with saline prevents coronavirus infection. This one is false. There is no evidence to show that regularly rinsing the nose with saline has protected people from infection with the new coronavirus. There is some limited evidence that regularly rinsing the nose with saline can help people recover more quickly from the common cold. However, regularly rinsing the nose hasn't been shown to prevent respiratory infections. Statement G. The coronavirus came from bat soup. And this one is also false. What we know about the current coronavirus disease is that it started in Wuhan in China in a wet market where there is a number of different animals there. So there is a couple of different speculations out there, but not from somebody obviously consuming bat soup. But what we do know, obviously, is that once you actually get coronavirus disease, the form of transmission is obviously through droplet spread. So coming in contact with somebody that is sick with coronavirus disease, close contact with them, or contact with their droplets right shortly after. Statement H. Eating garlic can help prevent infection. And this one was false. Garlic is a healthy food that may have some health benefits. However, there is no evidence eating garlic can protect people from coronavirus. Statement I, the last one. The first symptom of COVID-19 is cough. And this one is true. At the initial stage of infection, the new coronavirus actively reproduces itself in the throat and upper respiratory tract. Then the infection goes down and can reach the lungs, causing inflammation. That is why the first symptom of infection is a cough. Only then the temperature begins to rise. And this is another tiny little of interactive for you. Please do a print screen of this slide stating your new habits during this quarantine. As you know, your timing and your regimen has changed slightly, and this is a stress for you, and it may be turned into eustress, which may affect you positively. So acquiring a new habit during this period would work pretty well, especially knowing the fact that we still have 21 days, which is the essential number of time that is required for your new habits. Also, a lot of people and companies need your support right now. Tag people and companies you want to help in the next field. And as all of us are students, and everyone is eternal students in fact, put on your learning objective until the end of quarantine in the third field. I hope you enjoyed our presentation and you'll join us for the next time. Thank you for your attention and see you on the next Friday. Our next topic would be nervous system and stroke. Bye bye.